would say the main role of the psychiatrist is to ensure the best possible psychological and social well-being of the person with dementia and their families. First of all, the psychiatrist conducts a comprehensive assessment of the person, including cognitive, activity-related, behavioral and interpersonal issues. For example, many people with early-stage dementia are depressed and withdraw socially. In such cases, treatment may include behavioral approaches which are very similar to those used in older adults without dementia. Treatment would also include information about the disease and teaching effective coping strategies. Introducing positive and enjoyable activities plays a really important role here. In more advanced stages, most people with dementia develop behavioral and psychological symptoms of dementia, which can be very burdensome for patients and their carers. For example, apathy, anxiety, irritability, delusions or hallucinations, aimless wandering or fidgeting. Some of these behaviors may be caused by physical problems like pain or infections, which can be detected by carefully examining the person and then be treated. In addition, circumstances need to be identified that trigger, maintain or worsen these behaviors. For example, some person with dementia may feel offended and react aggressively because they misinterpret the situation. Also, adjusting the environment can be very helpful. If someone with dementia in a long-term care facility, for example, shares a room with another person, they may become agitated because he or she is scared by the behavior of the roommate. In that case, a very simple solution would be to separate the two people. If behavioral symptoms cannot be managed otherwise, the psychiatrist is the specialist for prescribing the psychotropic drugs, particularly antidepressants and antipsychotics. It's important to find a type and a dose of medication that effectively reduces the target symptom but produces a minimum of side effects. Also, medical comorbidities as well as interactions between the drugs must be taken into account. Once treatment with an antidepressant or an antipsychotic has been initiated, the moment for tapering down and stopping the drug must not be overlooked. Although the psychiatrist focuses on the person with dementia, the well-being of the primary carer and the entire family is also his concern. If carers are distressed, depressed or overburdened, they require appropriate counseling and may need additional support. Ideally, the psychiatrist should work closely together with a social worker who has the expertise to manage the many practical problems that are associated with dementia. If needed, the psychiatrist can also refer the person with dementia to a psychologist or for some form of psychotherapy or family counseling. If occupational therapy, physical therapy or speech and language therapy have not been launched by other members of the therapeutic team, it is the role of the psychiatrist to initiate and coordinate these interventions and ensure that all actors receive the necessary information about the person with dementia.